Hey everybody, I got this next question from one of my clients on email. Just listen. Hi everybody, please how can I get rid of early ejaculation and feeling very tired after the first round? I mean, what are the causes and solutions? My partner seriously complains about it. I don't last more than 1.5 minutes in the first round, and after that I get so tired I wouldn't be able to attempt a second round. In today's video, let's talk about how to manage premature ejaculation. Make sure you stick around to the end because I also include some tips that are not medication related. Let's get into it.
Hey now, take a step outside and seize the day now. Set aside your worries, it's okay now. The sun is here to stay. Blue skies, feel the wind beneath you as you fly.
Hey there, welcome back to my channel. If this is your first time joining me, I'm Dr. Sylvia. I'm a general practitioner and the founder of Ask Away Health, where we provide you with direction and clarity about everything medical. Subscribe to our channel and don't forget to click the notification bell so that every time we publish a video, which tends to be once a week on Saturdays, you'll be the first to hear about it. So let's just get straight into today's topic. Premature ejaculation or early ejaculation is when a man ejaculates too early or orgasm occurs within the first 1 to 2 minutes of sexual activity or any time before he and his partner are sexually satisfied. Most men experience premature ejaculation or PE at some point in their lives. We're not really clear why. We don't know exactly why premature ejaculation happens, but there are thoughts that it could be of psychological origin and it could be of non-psychological origin. In fact, the thinking now is that the cause is more likely to be psychological than other possible physical or non-psychological causes. So in this video, we're going to look at mainly the possible psychological issues or scenarios associated with premature ejaculation. Now, before I do that though, let us just look at some of the physical conditions that can cause a man to experience premature ejaculation. So I'm just going to quickly whiz through the list. One of the things that could be responsible for premature ejaculation is medication or drugs. Now this could be both prescribed medication or it could be recreational drugs. In the case of prescribed medication, it might be as the side effect of the drug, while for recreational drugs it may simply be as a result of misuse, and this is the effect of the recreational drug. Closely related to this, excessive alcohol or alcohol misuse has been associated with premature ejaculation. Conditions that affect the prostate, that small walnut-shaped gland that sits underneath or at the base of the urinary bladder in men. Conditions such as prostatitis or benign prostatic hypertrophy, that is enlargement of the prostate gland that is not as a result of prostate cancer. These conditions have also been associated with premature ejaculation. In addition, infections like urethritis, which is inflammation of the urinary tube, the urethra that runs along within the length of the penis, could result in premature ejaculation. So the point I'm trying to make is that premature ejaculation can have a lot of different possible causes, and usually the job of the doctor is to listen to you and work out the symptoms and carry out examination that might indicate what the cause might be. So there are some possible physical problems that could lead to premature ejaculation. But let's look at the psychological causes next. Now, when it comes to psychological causes, let's look at 5 possible scenarios that could be associated with premature ejaculation. The first one is early sexual experience. In other words, what was the man's initial sexual experience the very first time he had sexual intercourse? Was it a rushed activity, something done covertly, trying to hide from being caught, away, hidden away somewhere, and there was so much pressure to get things done quickly? Was it that kind of scenario? Because it's thought that such initial exposure or experience with sexual activity may contribute towards developing premature ejaculation in some men. The second scenario is performance anxiety. And what this says is men developing anxiety about sex that could affect their sexual performance. Now, this pattern is often seen in new relationships. The anxiety is worse when the sexual encounter begins, and a vicious cycle develops because one is anxious to perform, and that affects one's performance, and so that leads to more anxiety, and then it just perpetuates, going round and round, and that is how performance anxiety could potentially lead to premature ejaculation. The next scenario is quite interesting. It's something called internal insight, and this scenario indicates that there are some men who are able to identify when they're about to ejaculate using some internal cues that they've developed over time, and so they can slow themselves down or prevent themselves from ejaculating before they're ready. It is thought that guys who suffer from premature ejaculation do not have these well-developed internal cues, and that is why they experience the condition. Now, the fourth scenario is low sexual desire. Sometimes with premature ejaculation, the problem is the man having a low sense of arousal or low sexual desire. Now, the sexual process goes like this: from desire, then arousal, and then orgasm. Now, men are capable of achieving an erection even when they are not aroused. And so it is thought that for a man who has premature ejaculation, he will need to be at an even higher level of arousal in order to be able to achieve an erection and control ejaculation when it needs to happen. And the fifth and last scenario that I wanted to look at today is about age and sexual experience and behavior. Now, younger men ejaculate more quickly than older men. It is thought that this may be down to sexual experience. Younger men are also more likely to have premature ejaculation from the reasons of performance and anxiety. And it's also thought that the longer the period since the last ejaculation for younger men, the more likely they will experience premature ejaculation when next they have sexual intercourse. Okay, so we've looked at premature ejaculation and possible causes. We know that causes can be varied, so there's no one treatment suits all. It can happen to men at different ages. There can be physical causes, including medical conditions and drugs and alcohol, and there could be psychological causes. And we've gone through 5 potential scenarios that could be associated with premature ejaculation. How can we treat premature ejaculation? The best way a man can delay ejaculation when it is due to psychological causes is to learn how to identify and control the sensations leading up to orgasm. Now, there are a number of ways to do this, either using medication or physical therapy. Let's start with physical therapy. For the Master and Johnson technique, you will need your partner to be present. Now, during sex, when you're about to climax, ask your partner to stop and allow yourself to gradually lose the erection. Then relax before starting again to have sex, and repeat the process, but each time coming closer and closer to orgasm, but pulling back before you do, relaxing, and then start again. And by so doing, retraining yourself in order to learn how to delay the process of ejaculation. The next technique is the squeeze technique. How obvious. But this is a process or technique that again is done with the help of your supportive partner. In this case, you get your partner to squeeze the head of the penis just as you're about to climax. The squeeze forces blood out of the head of the penis and reduces the erection and cancels the orgasm, giving you a chance to relax and then start again. So it's again another training technique, all geared towards helping you to prolong that period to ejaculation. I'll mention masturbation here, although there are different thoughts about the benefit of masturbation in treating premature ejaculation, because some people suggest that masturbating 1 to 2 hours before sexual encounter may help to delay ejaculation, but it may not be effective in everyone. On the other hand, if you do not have a supportive partner, it may be that obviously the Master and Johnson technique might not be suitable for yourself, and masturbation might be one way to begin to retrain your mindset with regards to delaying ejaculation. The next technique is sexual position, where it is thought that changing from the traditional missionary position to one where the partner is on top might help to manage and retrain the individual with premature ejaculation. So in this case, the man lies on his back, allows his partner to lie on him, and has control of penetration while he guides, or while you guide your partner. And then when you're close to ejaculation, you ask your partner to pull away, so there is relaxation of the erection. And again, the same process like what we've already discussed before, because it's all about training the individual to come to a place where they can delay the period of ejaculation. Another sexual technique is changing the thrusting angle for men, and changing the rate or the rhythm of thrusting during sexual intercourse. That may contribute to, or that change might stimulate a delay in ejaculation, and in some men has been found to be of some benefit. Another technique in some men who are able to do so is by taking a deep breath during sexual activity when close to ejaculation, because it is thought that this deep breath shuts down the ejaculatory reflex, which is the nerve-controlled reflex in the body that allows ejaculation to happen. So taking a deep breath, a deep purposeful breath to try and slow things down and shut down the ejaculatory reflex is another method that is suggested to help in delaying ejaculation. Another method that sex therapists consider to be of benefit is using mind control. And the examples that they use are asking men to focus on other areas of the body during sex and not just the penis, or distracting yourself from thinking about sex and thinking about something else. And apparently some men think about football or think about maths to help to delay the time to ejaculation. So those are the physical techniques that men with premature ejaculation could adopt to help to treat the condition. Now I want to talk briefly about some of the medicines that could be available and used for this to treat this condition. Now I think it's also good to mention, if I haven't done so already, that the sooner that you go to your doctor if you have a problem with premature ejaculation, the sooner you go to your doctor to have a frank and open discussion, the better for the doctor to be able to identify and decide whether this is a physical cause or psychological cause, and so you can get the right treatment. Because a lot of people might believe there's just one trick or one solution that solves the problem. No, if you're hypertensive, for example, or taking medication to treat hypertension, and one of the side effects is premature ejaculation, then the treatment is going to be different from somebody who suffers from performance anxiety. So I just thought it's good to chip this in here. I know it's an embarrassing condition to talk about, but it's one that is treatable. But leaving it to go on for years and years because you're too embarrassed to speak to the doctor is really depriving yourself of, the possible benefits of treatment, of rapid treatment. Okay, so let's talk about the medication. The first group I would like to talk about are creams that are used to manage or delay ejaculation. They're actually creams that contain anesthetic agents. These are thought to help to reduce the sensation in the penis and as a result can reduce early ejaculation. But the downside is that some men feel it actually affects sexual satisfaction because less sensitivity would make intercourse less pleasurable. Okay, the second group of medical treatments that one could use are condoms. So condoms can be used by men, can be worn by men with premature ejaculation because they do something similar to what the anesthetic creams do. That is, they reduce the sensitivity of the penis, and by so doing some men find that it helps them to last longer before they ejaculate. And some sexual therapists will recommend the combination of anesthetic creams with thick condoms to treat men who have problems with premature ejaculation, and they found some benefit from this method. And the last category of medication I'm going to talk about are medicines within the group called selective serotonin reuptake inhibitors, SSRIs, more popularly and traditionally known as antidepressants. But some of them are licensed to treat premature ejaculation. For example, dapagliflozin is an SSRI that's used for men with poor control over their ejaculation. It's a specialist treatment medication, and it's used for men who have experienced symptoms for at least a period of 6 months, are experiencing significant emotional distress or social problems or interpersonal problems because of this condition, and who are experiencing ejaculation within less than 2 minutes of sexual intercourse. Now, it's usually recommended to be taken 1 to 3 hours before sexual intercourse. Now, it's usually recommended to be taken 1 to 3 hours before sexual intercourse, not more than once daily, and it's not recommended for men over the age of 65 years. Now, as an off-license indication, other SSRIs, for example fluoxetine, could be used but by specialists for treating men with premature ejaculation for whom other treatments like the physical techniques or the creams and condoms have not been of any benefit. SSRIs traditionally are used as antidepressant medicines, and like I said, it's off license. Ideally, it's something that should be properly discussed with your specialist or your healthcare provider, bearing in mind your medical history, ensuring that it's safe and not going to interact with other medication that you're taking. So none of this is for over-the-counter prescribing or use. So these are my thoughts about possible treatments and techniques that could help a man or a couple experiencing premature or early ejaculation. And if we go back to the question that we started with, this is what I would suggest to this individual, and it might be important to get some tests done along the line. There might be some blood tests needed because he talked about experiencing tiredness, and so you want to check that they're not anemic or they don't have other hormone imbalances. At the end of the day, I think the key message is that if somebody is experiencing premature ejaculation and in a relationship, then it's not just their problem, it's also the problem of their partner. And coming to seek medical attention early is better than not, because there could be some fairly straightforward solutions that could address this problem, which for some people can have significant impact. So I hope somebody has found this video useful. If you have, like it please, and let me know in the comments. And tell me, are there any other methods that you've heard about how premature ejaculation can be treated? I'd love to hear from you in the comments. If you've got any other questions on this topic, then by all means send an email. I'll put the link in the description. It's to info@askawayhealth.org. And as usual, I'd love to invite you to join our Ask Away Health community. We have a website, www.askawayhealth.org, and we welcome new members to subscribe. You get access to lots of very useful health information and tips through our weekly blogs and different write-ups. We respond to requests for health information online, and if you have a burning question that you want answered, we might decide to use your question as a video, of course keeping everything confidential. So thank you so much for watching, everybody. If you found this video useful, don't forget to share with a friend and subscribe to the channel, and I will see you again soon.
Hey now, take a step outside and seize the day now. Set aside your worries, it's okay now. The sun is here to stay. Blue